And with that, I'm going to turn it over to Michael because we're going to go a little bit deeper into how they did this as to what University Health System is and how, and then really kind of delve into how they did implement ISO 55001 there.
Thanks, Tia, and good afternoon to everyone attending today. My name is Mike Roussos. I'm the hospital administrator at University Hospital. Just thought we'd give you a little background of University Health System. University Hospital is part of University Health System. At the current time, we only have one hospital, soon to have two and maybe more in the future. But just a little bit, Tia, can you go back a little bit? There you go. Just a little bit of background. We actually are a governmental agency. We're a political subdivision of the state of Texas owned by the people of Bexar County. So really, if you look at our legal name, Bexar County Hospital District, we are a county entity. We have about 9,000 employees at University Health System, not just the hospital, 1,000 physicians, and we are a training institution. So our partner is UT Health San Antonio. So they are a bulk of our medical staff, but also trained about 700 residents, a little bit more than that actually, here at the hospital in our clinics. Our budget this year was almost $2 billion. We're in the budgeting season right now. We're going to be probably over $2 billion for 2021. So we are a large entity here. We do serve a lot of the underserved and underinsured here in Bexar County and the region. So that is part of our mission. We like to tell everyone that we're the hospital for everyone because we take care of everyone and are proud of it, and everybody gets the same great care who comes to any one of our facilities. Bexar County Commissioners Court appoints our board of managers. So here in Bexar County, each commissioner has an appointee to our board. The judge, Bexar County judge, has 3 appointees. So we report to our board, and then every year tax rate is set. So we're very proud that we have not had to raise taxes in multiple years. And we'd like to survive on our own as much as possible and not rely on taxpayer dollars to run a system. Really, it's a fiduciary responsibility. And that's where what Tia said earlier, it's not just the safety portion of it, but it's the fiscal portion of it too, that we really owe the taxpayers of Bexar County to do what's right and to use their dollars in an appropriate manner. And then again, our board, our county commissioners court also approves our annual capital and operations budget. We're very lucky here to have great support from our board and our county commissioners. Probably on average, not including large construction projects, $30 to $40 million annually in capital we spend within our health system. And another thing we're fairly proud of too is really less than 22% of our revenue comes from local property taxes. Here in Texas, about a quarter of our residents don't have insurance. So in San Antonio is fairly reflective of that, Bexar County. But like we said, we want to run a very structured organization that's fiscally responsible. And compared to other public hospital districts in Texas, we're at the low end of how much of our revenue comes from taxpayer dollars. So Tia, next slide, please. We thought it's important to really talk about our mission, and we open many of our presentations with this, but I'll just read it to you. The mission of University Health System is to improve the good health of the community through high quality, compassionate patient care, innovation, education, and discovery. And I think what Art and the team are going to talk to you today is part of the innovation piece. Lots of what we talk about in healthcare has to do with patient care. And here at a teaching hospital, we do a lot of research too. So there's a lot of clinical innovation, but being the first hospital that's ISO 55000, I guess 55001 and 2 certified, we look at that as part of our innovation as well. Next slide, please. Our vision is we're leading the way to become one of the nation's most trusted health institutions. Our patient care will be high quality and compassionate above all, attentive, kind, and helpful without exception, and wise in the use of resources. And I think what you will hear today from the speakers will really mirror what our values are, and that really permeates throughout our whole organization. Next slide, please. just to give you a little background, uh, University Health System is over 100 years old. That picture in front of you is the original Robert B. Greene Hospital, which is still downtown in San Antonio today, and we're actually doing some renovations on it. It was still in use and is still in use, but given some of the renovations, we had to clear out some of the services, ambulatory services being performed there. But in 1955, the Bexar County Hospital District was established by voters. And then 1968, the medical school became the primary teaching partner with University Hospital. So if you're familiar with San Antonio and come to the medical center here, we're actually attached at the hip to the UT Medical School here. So since 1968, we've had over a 50-year partnership with the medical school in Bexar County in San Antonio. So we're very proud of that. In addition, we're the first magnet designated health system in South Texas, and we're going to be recertified again. We just 2 weeks ago went through our third magnet recertification. We feel very strongly we'll be certified again, but that's a really big deal in the healthcare environment for those of you who aren't familiar with healthcare. But nurses are at the forefront of care for patients, and being certified as a magnet designated system is a really big deal because it really is a shared ownership type of model that we have. Next slide, please. So just some of the things we talk about the partnership, and we really focus on partnership with our innovation, but we do a lot of really high level tertiary quaternary type of things here. We do lots of trauma. So if you look at the map of Texas, I'm sure y'all are fairly aware of how big Texas is. You know, San Antonio's south central Texas. Our trauma services cover all the way down to the border and into West Texas. We see about 7,000 to 8,000 trauma activations a year, of which about 25% of those are PD trauma. So really busy trauma center. We perform about 300 transplants a year, kidney, lung, as well as liver. We have the second busiest living liver donor program in the nation. The level 4 neonatal ICU, the first level 4 maternity center, epilepsy center, PD heart center. And then we also have a large adolescent young adult cancer program for kids and adults kind of in the in-between years, you know, and that's an important thing here too. So we staff 700 beds a day. We're licensed for 1,000 beds, but we don't use all those beds. Some of those are in our older towers. We have 3 current towers now, soon to be a 4th with a new hospital being built in front. And Tia, if you turn the slide, it's after this, but this slide, and I won't go too much into detail. If you go back one, yes, please. This slide gives you an idea. Each bubble represents the number of visits in each facility that we have. So if you look at the bottom, you know, we have a large, really large hospital in the medical center with about 32,000 discharges in a year. And that's a lot of discharges for a hospital, but our tentacles throughout Bexar County spread in multiple locations. So every bubble on there represents a point of care for patients in University Health System. And we have about 24 other sites where we care for patients in the community, many of those sites in underserved areas to provide access to care. And really our goal is to not have people admitted to the hospital. We'd rather care for them on the front end, get them the prescription drugs they need, get them the primary care and specialty care they need to prevent patients from coming to the hospital. But as you can see, it's not just one large hospital. Really, the 90% of what we do is ambulatory. And our Robert B. Greene campus, that big circle there, sees just almost 300,000 visits just there. And that does not include imaging, that does not include labs. Those are our encounters with patients. So we see about 1 million patients in our ambulatory arena, in addition to the 32,000 discharges. So, you know, when people get sick, they come to the hospital, but we have lots of tentacles around Bexar County, and you know, we serve a lot from our surrounding communities as well. So very, very large ambulatory footprint as well. Next slide, please. This is just an example, and just wanted to kind of give everyone perspective. If you look at Art's screen, you see that hospital behind him on his on his picture, you can see that that's a fairly new tower that's to his, if you're looking at his screen to the right, that was erected in 2014. We actually have two more towers we serve patients in that they're the older towers. This one that you see on the screen here is our brand new Women's and Children's Hospital that's being built, set to open in 2023. And I show you this because for those of you who have been in hospitals, they're very, especially large academic medical centers, they're very large. They can be confusing, and especially when you have multiple towers and multiple hospitals connected, there's lots of places to hide things. So we have currently about 2 million square feet in the hospital, and this will be another 500,000 or 600,000 square feet. So if you can imagine the amount of assets we have in 2.5 million square feet, and then couple that with the amount of assets we have, if you remember the bubble slide we just showed, the 24, 25 other locations, that's a lot of assets. And many of your organizations may be bigger than this. So keeping track of those assets and efficiently using and disposing of them is very important to what we do on a daily basis. But that just gives you an idea of the size and scope of our hospital. But this is just a small piece of what we do around Bexar County. Next slide, please. And we talk about innovation and achieving results. This is just some of we're very proud of many of our achievements. And we have clinical achievements. We have health and safety of our community achievements. We do lots of community work with the city and county offices. But one of the things that we needed to put in here, if you go down to the bottom, is under technology, employee learning, and efficiency. We're very proud of supporting our employees and have won awards for what we do for our employees from an education standpoint and teaching. But in the bottom right-hand corner next to University Health System now, we have our logo for our ISO 55001 award. So we're proud of that, and that's part of learning too, and growing and innovation. So and that wouldn't be achieved without Art and his team and other members of our organization. So that we added it, we needed to add it, and we're very proud of that. So this just gives you an idea of some of the things we do in our health system. So on a closing slide, we'll just talk a little bit about what asset management's done here. We're the first hospital globally to achieve the certification. We recover, and it's really more than $200,000. I think Art's being a little conservative here, but by auctioning off assets, that's a fairly big number that the health system receives from auctioning off assets. Saving greater than 50% of the cost just for lobby and patio furniture by reupholstering. If you've ever been into a hospital or healthcare, you know that a chair isn't a chair. A chair is a chair marked up probably 10 times. A knife isn't a knife. It's called a scalpel, and it's probably marked up 10 times because it's used in a hospital. Well, everything's more expensive here. So if we can safely reupholster, refurbish, and keep track of our inventory, not just of furniture, but equipment, that's a big deal. And so Art and his team are really at the forefront of that. And then we have a very active recycling program. And I will tell you, possibly the biggest thing on here is the fifth slide, where clinical staff don't have to spend time trying to move, search, dispose of property. When I talked about a hospital, especially big hospitals, clinical space is very expensive. And so when there's a space somewhere that hasn't been used, you tend to find things being put there because there's no room to put it anywhere else. So if we can reduce the amount of time that our clinicians and our providers, from the more time they have to focus on patients to do their job, the better it is for patients within our institution. So really our asset management team, by taking over that function and owning it, really puts our caregivers and providers back into caring for patients. And so that's really, first and foremost of how we think. And I wanted to make sure I call that out, because the more time our caregivers are with our patients, that's a lot. That's not a financial impact. That's a clinical care impact, and that's why we're here. We have over 300 departments in the health system. It's a lot of departments, and there's a member appointed in each of those departments that represents them as an asset management advocate. So it takes responsibility And that's the partnership we talk about with our asset management team that really takes responsibility and works with our asset management department to ensure we're being efficient. The new thing that's happened, and we talk about a learning environment, our asset management team is now partnering with our facility management team to pursue ISO 55001 certification. So that's a pretty big deal. They're starting the journey now. Art can tell you a little bit more about it. But when you have a large hospital, some of which was built in 1968, some of which is new, you have lots of air handlers, you have lots of chillers, you have lots of mechanical things, and then spread that out over 24 or 25 locations. That's a lot to keep up with. So anything we can do to better manage those systems and use the ISO 55,000 standards will be a positive for them as well. So that's an example of the teams partnering with each other. And then really just standardizing everyone, standardizing processes throughout the health system. I think we talk about standardization. We just implemented Epic here. For those of you who don't know, it's a very large and integral part of our electronic health record, and really standardized processes are what we're trying to do throughout the health system, and asset management is a piece of that. So I think that's my last slide, but that gives you a little bit of an overview of University Health System. We're proud of serving our community, but we're proud of as a teaching hospital, we're proud of our partnership with UT Health, but we're proud of how the collaboration works within our health system. I think our culture really represents San Antonio and Bexar County. We're a very close-knit community. We're kind of a big, small town. We're military city, USA, and people support each other. And I think the asset management department here, working with everyone else, it mirrors that of what our community is here. So wanted to really thank them for the hard work. It's my job and our leaders' job to listen to people that have good ideas and then help them implement it. And that's what's happened here with ISO 55,000.